Good day everyone, my name is Kurt Sater from BSN14C and today I'm going to do a return demonstration about Glasgow's Coma Scale and Reaction Level Scale. So what is Glasgow's Coma Scale? Glasgow's Coma Scale is an assessment tool designed to note trends in a client response stimuli. Glasgow's Coma Scale can be used as an effective assessment tool in order to achieve a clear and objective evaluation about the patient's neurological status. There are three aspects of patient's behavior that is need to be recorded and observed during the assessment. These are the eye-opening, verbal response, and motor response, which subdivided in different levels of response. First, you must check the doctor's order for the neurovital signs. By checking the doctor's order will allow you to know that this assessment is needed for the patient. Next is observe universal precautions. By doing hand washing, this is to deter the spread of microorganisms and also to protect yourself. Next is prepares the equipment needed. So the equipment needed are pen light, gloves, and the NVS form. This is to save time and effort during the assessment. For the mental status, ask the patient's name, date, time, and other questions to test awareness. This assessment which allow you to know the level of awareness of the patient. Good afternoon, ma'am. I'm Curtis Sate from Davao Doctors College, yung student nurse. So, may I know your name, ma'am? Sino yung pangalan, ma'am? Birthday name mo, ma'am?
August 14.
Kabalo ka unsang adlaw karon, ma'am? Unsa man?
9.
Then kabalo ka kung asa ka? Asa mga karon?
Sa hospital.
Okay. So, ma'am, magbuhat og sa assessment, ma'am, ha? If okay lang sa imo, ha? Tanaw sa ko directly. Sa ko tanaw mismo sa mata, ma'am, ha? Okay. So, pag good girl ba ani, oy? So, next, ma'am, is kumuta akong kamot, ma'am. Kumuta jud. Okay. Ayan, ayan, doon na ito hindi. So far, malihok mo na ito itong TN, ma'am, no? So, ito adong ilihok ang kining na side. Sige, itaas doon na ito. Okay, next B. So far, okay man siya, ma'am. Thank you. The pupil assessment is done. This is to know if the patient's pupil is constricted and dilated. Normally, the size of the pupil is 2 to 4 millimeters diameter. For the hand grip assessment, this is done to check the strength of the patient, if it is strong or moderate. While in the leg assessment, this will enable you to know if the patient cannot move his or her leg. And now, I will be going to perform the assessment for eye opening, verbal response, and motor response. For the eye opening, is you may now observe if the patient responds spontaneously. If not, you may proceed to speech. Try to talk to patient or catch her attention. Hello ma'am, good afternoon. So observe. So if the patient responds to speech, record it and NVS sheet. If now, you may proceed to pain. Apply pain to the patient if he or she responds.
Right.
Observe. So if the patient responds, note it in the NVS sheet. If not at all, note it in the NVS sheet for none. Next is for the verbal response. So for the verbal response is try to talk to patient. Like what I did kanina, I already talked to the patient and you may now observe if she is oriented, disoriented, confused, inappropriate, or incomprehensible. So if the patient reacts or she is oriented, record into the NVS sheet. Next is for the motor response. So for the motor response is you may now apply some pressure to the patient if she or he reacts, if she is obeying, localizing, withdrawal, flexing, extended, and no response. So apply ko pressure.
Alright.
So note if the patient reacts to sustained stimulus you apply. If the patient is obeying, localizing, withdrawal, flexing, extending. If there is no response, note it on the NVIDIA sheet as none. Document responses and GCS sheet. Make sure to add total score at the bottom of sheet during each assessment. Document accurately and report for changes if any.